Hi, I'm Mary Lee Churchill, and I'm a licensed professional counselor here at Family Care Center in Colorado Springs. You know, it's never an easy task when a kid comes to us and tells us that they're thinking of ending their lives. Here's a few things that we can do to support adolescents and teens that are suffering from depression and contemplating suicide. One of the first things I'd like to talk about is what places a child in a high risk category. The very first factor is if they're male, and a male that abuses alcohol or drugs. Another factor is if they've suffered a recent loss, and that loss can be a divorce, their parents arguing, breaking up, or if they themselves have lost a job or their parents. These are things that we want to look for. In addition, if they know a suicide victim, that places them in a very high risk category, or if they suffer from depression. Kids that come from a rigid background are at high risk, as well as kids that have a misunderstanding of death. There are some things that we can do to intervene and to help support these kids. One of the first things we can do is to listen intently and empathetically. A second thing that we can do is ask them outright, hey, are you thinking of committing suicide? Are you thinking of ending your life? What does that look like for you? It doesn't increase the chances of committing suicide. Asking them directly helps figure out if they have a plan or what they're thinking. The next thing that we can do is provide them with support and break confidentiality. That's a tough thing to do because a lot of us want to earn their trust, but do not let that child leave your sight until you've notified someone to help and tell them, I'm sorry, but I'm going to have to get you some help. Kids can be helped in prevention with talk therapy, with drug rehabilitation, and absolutely turn their thoughts around. Another thing you want to do is make sure that you don't leave the child alone until they're in the hands of someone that can help. For instance, a mental health clinician or someone in a facility that is an intake specialist or the emergency room or even a police officer. I hope these tips have helped, and let's work together to prevent suicide in our community. Thank you.